Good morning. I'm now joined with a familiar guest here in our Pop Spot 2 studios, Dr. Scott Hamilton. We're talking about an important topic that's going on right now. Good morning to you, Dr. Hamilton.
Morning,
Thanks for being
Sylvia.
with us.
So it's Christmas. How's your Christmas list coming?
Hey, it's coming right around. But I mean, we have to talk about some important stuff. I mean, flu, RSV, COVID going around.
All three.
Hospitals are full.
And the reason I talk about Christmas lists is you got to getting your flu shot on your Christmas list, because I got my flu shot in early October. I saw the writing on the wall. Things were going to ramp up extraordinarily. I had my flu 2 weeks earlier than I thought I was going to get the shot. And then 2 weeks ago, I'm like, I better get that new COVID thing. That's ramping up again, too. It was ramping up in New York State. So 2 weeks ago, I went to a pharmacy and got my bivalent COVID shot. So on your Christmas list, besides getting all your junk and your want to help me wrap some stuff there, Sylvia?
Sure, yeah, I can.
Get all your stuff wrapped. Put it on your list. Get your flu and COVID shots. Christmas is coming up. You're mixing with grandma, mixing with other people. It spreads in these family events. So you want to put on your Christmas list getting those shots.
So all of these infections are going on right now. Specifically what? And
okay,
I mean,
yeah. So influenza, the worst year in 14 years for influenza. It's early. It's rampant. Schools are closing like crazy. RSV. RSV used to be seasonal, a late winter thing. Now it's year-round since the COVID epidemic kind of went away. So RSV, highly contagious, hard on babies and toddlers. It's going on like crazy too. Third, COVID is kind of ramping back up again too. And fourth, for the kids 4 years and older, the school-age kids, strep throat's going crazy. That's also highly contagious. I was just telling Sylvia earlier, the pharmacies are running out of the antibiotics that we use to fight strep throat. So, you know, it's a she uses triple-demic? Triple-demic is actually a quadruple-demic, if you consider the school-age kids. So, yeah, lots of illness out there. So, you know, you hate to tell people, okay, time for masks again, time for shots again, but it is that time again.
Oh,
so let's go to that. Do we have the graphic? Yeah, so get your flu and COVID boosters. Boosters, kids can get them too. In fact, they just announced that the new bivalent COVID covers the original COVID and the new Omicron. Kids down to 6 months can get that vaccine, and very important. Wash your hands, of course, and consider wearing your mask again. I wear them in rooms when I go in, not so much for COVID, but I don't want to get the flu either, even though I've had the shot. Plan your holiday parties carefully. These are the places that these places spread. Many people get sick, and if you've got grandmas at that party, my mother-in-law in their 90s, we want to make sure we don't give any of those people, because the hospitals are also full of, getting full with COVID patients again. And elderly COVID patients, people are vulnerable, people have not been vaccinated. So plan your holiday parties carefully so you don't get people who shouldn't get sick, so you don't get them sick.
ParentsDon'tFret.net.
And yeah, get your vaccine, okay? Yeah, and for more information on how to take care of your kids and keep them out of the emergency department so I can have a quiet Christmas, go to the bottom of your screen, ParentsDon'tFret.net. For all kinds of ways to keep your kids out of the hospital, keep your kids out of the ER, and keep your kids happy for Christmas.
That's what we want. All right, Dr. Hamilton, thanks for joining us. We'll be right back.